What we'll do is we'll just focus on two components of extension and flexion, and that's looking at the humeral ulnar component. And so when we're looking at that component, when we have a resting position, remember, resting position is about 70 degrees. So if you're looking for that loose packed or resting position and you're just trying to do some distraction to get things moving, you can have them at 70 degrees. If we have a loss of extension, we're going to get into this extension here and pronation, and then we can do some distraction. Remember, the closer to the end of the motion you have, the more you're going to have a rotational component involved. When you're in that extension and you're doing the distraction, you're holding it. If this is a tight joint and not painful, you don't have to oscillate. You're just holding it. And then you're saying, okay, can you turn your palm down? Good, and straighten. And at that barrier, when they relax, that's where you hold it. Pain shouldn't be any greater than 4 out of 10. If you're modulating pain, that's when you do your oscillations. Otherwise, you don't have to worry about it. If it's a loss of flexion, we go in the other direction. Let's say the loss is here. I can be in this position. I can fix the humerus, and I can do strong distraction and have him push into my shoulder to create elbow flexion, which will create the appropriate glide as I do distraction and I glide. Remember, this is a very deep joint, so you're going to have to do distraction and rock the joint. If all of a sudden I was like, okay, well, I think I've maxed out what I can do at the humerus and ulna, I can check out what's going on at the radius in humerus. It's a concave on convex, so the direction's the same direction. So then if I get him to his barrier, I can get onto the radius and glide it in the same direction. So he can again flex into me and relax, and then I can push and glide. You can also get your thumb in this position, and after you do all your safety checks, you could do a manipulation on that, where you could actually get into this position and manipulate it, where you're gliding in that same direction. So if you're getting stuck on how to gain that, that is the best way to do it. And again, if we're in that pronation and extension, then the glide has to go in the same direction. And this is where you might have to fix things to get that glide. You have to get around the extensor mass, which gets definitely a lot tauter as you go into that extension. So you have to get on that radial capitular joint, find out where you want to get that glide, and then produce that posterior glide with pronation and extension for that combined motion. If you're like, oh, I don't know, I'm not as comfortable doing that, you can go mulligan and do some mobilizations with movement in one direction, especially if you're not worrying about pain, because remember, with a mulligan mobilization, the rules are sustained glide and mob through the range with no pain, over pressure. Sustained glide if we were going in the other direction, mobilization and over pressure. So that is the humeral ulnar and humeroradial joints with associated glides to improve mobility or modulate pain.